Hello everyone. So let's discuss the biochemistry section of your paper. So question number 1. Gluconeogenesis occurs in which of the following compartments of the cell? So guys, this is the question which is based on the site or the location of a particular pathway that we should always remember. So to remember the pathway, we can remember this mnemonic that there are few pathways which occurs in both mitochondria plus cytoplasm. Okay, so both the areas of the cell are used, and for this we can remember a mnemonic that is PUBG. Okay, so where the P stands for the pyrimidine synthesis. Okay, U stands for urea cycle, right? And B for blood synthesis. So guys, blood means heme synthesis, like the pathway which makes the heme. And G for the question gluconeogenesis, right? Now guys, when we talk about the gluconeogenesis, right, so the answer for this question is C. Okay, so for gluconeogenesis, there was an old question which was asked like this, that the sequence will be cytoplasm, mitochondria and endoplasmic reticulum. Okay, cytoplasm, mitochondria and endoplasmic reticulum is also involved, right? Now guys, there is a pathway that is called as glycogenolysis that also uses cytoplasm plus endoplasmic reticulum. So endoplasmic reticulum, the last enzyme glucose 6-phosphatase that is also deficient in von Gurkis is also part of endoplasmic reticulum. So glycogenolysis. Then guys, there are a lot of pathways which occurs only in mitochondria, like we can say beta oxidation of fatty acids, for example, and electron transport chain, right? Then there are pathways which occurs in certain other parts of the cell, like peroxisomes, right? So peroxisomes, guys, they have certain pathways which are happening there. For example, the very long chain fatty acid oxidation. So in the PX for peroxisomes, very long chain fatty acid beta oxidation, right? So fatty acid and the defects in peroxisomes are associated with Zellweger syndrome, right? Zellweger syndrome also. So remember some of the pathways like this. Also the alpha oxidation also occurs in alpha oxidation of branch chain fatty acids, that also occurs in peroxisomes. So that is again deficiency causes the Refsum's disease, which is again an important question, right? Okay, fine. So remember the mnemonic PUBG, fine, for the common questions which have been asked in exams. Okay, next question. So there are total 17 questions here, and so we are on question number 2. Okay, which enzyme is deficient in von Gurkis disease, right? So guys, in the von Gurkis disease, the type 1 glycogen storage disorder, fine. So first of all the names that we should know, that is type 1, type 2, 3, 4, 5 and 6. Okay, so we have to remember the name of all the disorders. Okay, so we can remember a mnemonic that is like, let's make it V for V, von Gurkis disease. So you can remember a mnemonic that is Viagra pills can augment the male happiness, right? Okay, so that will be more convenient to remember. Viagra pills can augment the male happiness. Okay, so that you can remember. So V for the von Gurkis disease, right? What's the name of enzyme deficient in the von Gurkis disease? There is a deficiency of an enzyme that is called as glucose 6-phosphatase. See, von is 1 and G for Gurkis and G for glucose 6-phosphatase. So that is ending with the G. Von Gurkis, G for glucose 6-phosphatase. Now P for Pompe's disease, right? We all know Pompe's disease. Now guys, in the Pompe's disease, this is the only disease which is also a lysosomal storage disease. That means the glycogen accumulates in lysosomes. Okay, so here the heart is commonly affected. So Pompe's affect pump. Find one thing. Now guys, Pompe's affect pump. If I write like this, Pompe's affects the pump. Pump means heart. And guys, heart has 4 chambers. right? So heart has a 4 chambers, and these 4 chambers represent here that the name of the enzyme that we can remember here, that is called as alpha 1,4 glucosidase, right? Alpha 1,4 glucosidase, okay? Or we can also call this acid maltase, right? Acid maltase, clear? Then we have C for the Cory's disease. Now guys, in the Cory's disease, the name of the enzyme deficient, okay, A for Anderson's disease, okay, so ABCD, remember like this, A branching enzyme, Anderson branching, Cory's debranching, right? So Anderson has the branching enzyme deficiency and Cory's has the debranching enzyme deficiency, right? Debranching enzyme deficiency. Now guys, debranching is also called as alpha 1,6 glucosidase, right? So guys, also remember like this way that Cory's means core means our abdomen means like 6 packs, though we don't have, probably you might be having, right? So debranching enzyme, that is alpha 1,6 glucosidase. So remember like this, core has 6 packs, heart has 4 chambers, right? Okay, otherwise ABCD, very simple. But sometimes the examiner will mention alpha 1,6 glucosidase like that. M for McArdle's disease. So we all know McArdle's disease. And guys, in the McArdle's disease, there is a deficiency of the enzyme that is called as muscle phosphorylase. Okay, muscle phosphorylase. So M for muscle phosphorylase, M for McArdle's. H for Hirsch's disease and hepatic phosphorylase, right? Then guys, there is type 7 disorder also, that is called as Tarui disease. Okay, Tarui disease. Okay, so guys, Tarui disease, remember like turai, remember that you wanted to do a party and your mom make turai ki sabji, right? So in the Tarui disease, what is deficient? PFK1, right? That means you wanted to do party, but your mom made what? Turai ki sabji. So party fir kabhi, right? Today you have to consume turai, right? So that is just the way to remember, else you can make your own. So party fir kabhi karenge. Clear? Abhi bas padenge. So that is all the disorders. But guys, I also want you to remember the GSD type 0. That has been recently asked in some other exam. GSD 0, in the GSD 0, there is a deficient enzyme that's called as the glycogen synthase. Okay, glycogen synthase. Clear guys? So that's all to remember, all the glycogen storage, very important MCQ, always there in the exams, most common, one of the common MCQs, right? Okay, 4-week-old female was brought to the hospital by her parents. The infant appeared lethargic, complaining of persistent jaundice, failure to thrive, and has a distinct rotten cabbage. Guys, actually, instead of rotten, the word should be boiled cabbage. This can be just to make you distract from the what you know already. Okay, so boiled cabbage odor from her urine. Biochemical examination shows amino acid urea and the phosphate urea. Which of the following is the most likely to be the clinical diagnosis? So guys, just mentioning the order. If you remember the order, we can easily remember. So like in the maple syrup urine disease, this is not the answer. The order is called as burnt sugar order. Isovaleric. Okay, it is isovaleric. This is misprinted here. So isovaleric acid urea, that is a order that's called as the sweaty feet order, right? Phenylketone urea has mousy or the musty order. And guys, tyrosinemia is our answer. That has a order that is called as a boiled cabbage, or we can also call this as a rancid butter, right? Rancid butter or the boiled cabbage. Any other order that we need to remember? Guys, we can remember one more order here, that is called as a tomcat urine order, right? What is tomcat urine order? That is found in biotin deficiency, that is a case of multiple carboxylase deficiency, right? So multiple carboxylase, right? Biotin deficient enzyme, dependent enzymes are known as carboxylases, like pyruvate carboxylase and gluconeogenesis. Okay, so multiple carboxylase deficiency or the biotin vitamin deficiency. Any other order? Right? So guys, you should know all the orders. Whatever the orders that you have, you must know them. These are the most common one in the exams, right? Okay, so that is our case of tyrosinemia, right guys? Guys, just for your mnemonic purpose, tyrosinemia. How to remember the tyrosinemia? Okay, everything about tyrosinemia or tyrosin. So guys, tyrosin, right? That means TYR. Let's say the tire. Okay, tire. So where is a tire present? So tire is found in the car or the cab, right? So that's way you can remember cabbage like order. And guys, car, C for catecholamine is one of the product of, like dopamine for example, is the catecholamine, right? So catecholamines are the product of tyrosin. Then we have, apart from this, so tire is in the on the car, right? In the car, tires are what color? Black color, right? So this is a tire which is black in color. So what is black that makes us black? Melanin, right? Melanin is one of the product, okay, which is deficient in albinism, right? So this black color tire, so it was running on the road, so tire on the road, okay? So tire on road, right? So just remember thyroid, okay? So just similar to that, tire on road, thyroid, thyroid, clear? Then guys, we have the next one, that what is the name of the enzyme deficient in tyrosinemia? Again, a common question. So guys, when the tire was running on the road, there appears the fire because it was running at a fast speed. So guys, tire, there is a fire, catches the fire. Because it catches the fire, the fumes appear, right? Fumes appear, and the fire or the fumes are doused by adding the water, right? So we will just add the water to it. So water means hydro. So guys, just to remember the name of the enzyme, fumaryle, okay, fumaryle acetoacetate hydrolase. What's the name of the deficient enzyme? This is the name of the enzyme, simple. Fumaryle, fumes, acetoacetate means appears, A for appear, fumes appear. So acetoacetate hydrolase means we added the water to it. So imagine a tire and like this. There guys, that's it. That's all about tyrosinemia. Which of the following is true related to the energetics of glycolysis? So guys, glycolysis, in the anaerobic, we get 2 ATPs. So that's our answer. In the aerobic glycolysis, we get 7 actually. So not 6, right? So this is my answer. Option number A, right? Guys, some of the points that you should know apart from glycolysis is that on the complete oxidation of glucose, you will be getting 32 ATPs, right? 1 acetyl-CoA in the Krebs cycle makes the 10 ATPs, right? 10 ATPs. And lactate to glucose conversion, right? When you do the gluconeogenesis, lactate to glucose conversion, 6 ATPs are used. How much? 6 ATPs are used. And guys, 4 ATPs are used in the peptide bond formation, right? Peptide bond formation during the protein synthesis. So that's it. This much you should know about the number of ATPs. Clear? Moving to our next question. Which of the given are formed in the HMP shunt pathway? HMP shunt pathway, see guys, also called as pentose phosphate pathway, right? So you should always remember the other name, pentose phosphate pathway. So obviously it is making a pentose phosphate. So option 3 is correct. It is also making NADPH. So 2 and 3 are correct, right? So that is our option number B, right? So remember, hexose monophosphate shunt produces NADPH, and NADPH is very, very important for maintenance of reduced glutathione, right? And that's why the deficiency of G6PD kya hoga? What happens? The NADPH levels will be low, and because of that, glutathione levels will be low in RBC, and that's why it will be easily damaged by the oxidative stress. Clear? So that's the point. So that is an answer. Simple one, right? Okay. Then comes the next question. A 40-year-old male chronic alcoholic, right, present with the complaints of forgetfulness and unintentionally making his own stories to fill the gaps, right? So you already made the diagnosis. Okay, difficulty in walking, that is ataxia. After examination and laboratory test, diagnosis was established, and the patient was explained that, because of alcohol abuse, there is vitamin deficiency. So, guys, which vitamin deficiency? So, this is a case of, as we can see, this is a case of because of excess alcohol consumption. This is the patient presenting with Wernicke's, okay, Wernicke-Korsakoff, okay, psychosis, yeah, Wernicke-Korsakoff syndrome. Okay, in the Wernicke-Korsakoff syndrome, this is vitamin B1 deficiency. Okay, B1 deficiency is there. Fine. So the Wernicke's syndrome without Korsakoff present with GOA. That is G for the generalized confusion, O for ophthalmoplegia that present with the nystagmus, horizontal nystagmus, and A for ataxia, like not able to walk straight, as in the MCQ also, right? So global confusion G, O for ophthalmoplegia, A for ataxia. Now apart from this, in the Korsakoff, what happens? There is memory loss and confabulation, right? So first there will be definitely the memory loss, and confabulation means making own stories, right, to fill the gaps that I like yesterday I went to a party, but then I don't remember what happened. Then this is unintentional making of the new stories, and I met someone special, right, like that. You got my point? So that is memory loss and confabulation. Clear, guys? Okay. And which part of the brain is most commonly affected in this case? That is also a question. So thalamus and mammillary bodies, right, are most commonly affected in this case. Right, guys? So that is vitamin B1 deficiency. Okay, guys, vitamin B1, one thing that I want to just tell you here, that to remember vitamin B1 or thiamine, so to be number 1 in life, okay, that is B1. Okay, so what mnemonic that you can remember? So to be number 1 in your life, what you can do is, first is you avoid alcohol, right? Avoid the alcohol. Then, okay, then we will do the studies. So पढ़ ले, right? So lactic acidosis. देखो, just to remember, I'll tell you again. See, पढ़ ले, lactic acidosis, right? Then Wernicke's, Verna. Okay, avoid alcohol, पढ़ ले Verna. क्या होगा? Like if you don't study, what will happen? So पढ़ ले Verna. Then Bura for berry, right? So Verna and Bura. क्या होगा? Bura, थक जाएगा, right? Okay, or you can remember something else, like Bura thakega, right? So I'm writing TK. So TK for, guys, very important question. That is the name of the enzyme that's called as transketolase, is the name of the test. Bura means, I mean to say, berry, right? Wernicke's encephalopathy, lactic acidosis due to the PDH deficiency. Lactic acidosis is very important. PDH is very important for carbohydrate metabolism, and avoid the alcohol, right? So that's all about thiamine that you should remember. Okay, so see, again there is a question on vitamins. So which of the following vitamin deficiencies are incorrectly matched with their syndromes? Okay, so what is the answer? Which of the following vitamin deficiencies are incorrectly matched with their syndromes? Okay, So guys, B3 deficiency causes niacin deficiency causes pellagra, correct. So this is correct. B5 deficiency megaloblastic anemia, no. This caused by the B12 and folate, as we all know. So that is not correct. Okay. Vitamin E, hemolytic anemia, correct. And guys, also you can remember the cerebellar ataxia, right? Cerebellar ataxia. Okay. Though it is rare, I mean, like vitamin E deficiency is rare. B7 or biotin. Guys, biotin deficiency doesn't causes the burning feet. So my answer is 2 and 4. So this is the answer, 2 and 4. Burning feet syndrome is caused by B5 deficiency, right? And B7 deficiency causes multiple carboxylase deficiency, I told you, which presents with the Tom-Cat urine order, right? And that can be caused by consumption of avidin, that is raw egg white. Am I clear? Okay. So guys, these are the points that you should know. Okay. Let me just revise very quickly. Thiamine deficiency, most importantly, we have discussed already. Riboflavin deficiency presents with the angular stomatitis, right? And new blood vessels around cornea. So circumcorneal neovascularization. Pellagra, you all know, and pellagra is caused by consumption of corn, right? And presents with the Castle's necklace. Then B5, burning feet syndrome, and active form is coenzyme A for B5. Then B6, pyridoxine. Pyridoxine deficiency present with a lot of features, and number one that you have to remember is the neonatal convergence, right? Second you have to remember is the homocystinuria, right? Third you have to remember is microcytic anemia, just like iron, microcytic anemia or X-linked sideroblastic anemia. Okay, please note down. Okay, X-linked sideroblastic anemia. So that is all about B6. Biotin deficiency causes multiple carboxylase deficiency. Then also it causes a disease that's called as Lener's disease. That's a type of dermatitis plus diarrhea. L-E-I-N-E-R. Fine. Then after biotin, we have the next one that is folate and B12. So guys, folate and B12 deficiency causes megaloblastic anemia, and B12 deficiency, always remember your last year question, causes methylmalonic aciduria. B12 deficiency also causes methylmalonic, but not folate deficiency. So a patient with megaloblastic anemia but high methylmalonic acid, its B12 is the best answer. Patient with megaloblastic anemia but methylmalonic acid is normal, okay, can be folic acid deficiency, right? If I have to choose between the two answers. Clear? That's it. Okay, vitamin C deficiency is called as scurvy, that you all know. Vitamin D deficiency is rickets and osteomalacia. Vitamin E deficiency, I told you. And vitamin A deficiency is night blindness, right? That is number one. And phynoderma, don't forget phynoderma. That is number 2. Okay, that's all. Deficiency of which of the following minerals? So guys, remember my suggestion. Vitamins and minerals you should revise on the last day before your exams. 100% you will be having at least 1 or 2 MCQs, and that is not 1 or 2. That doesn't mean just they are having few marks or something like that, but you have very high chances to get multiple questions on vitamins. Minimum 1, I assure you, right? Okay. So deficiency of which of the following minerals leads to Keshan's disease? So the answer is clear. We all know answer is selenium. So guys, zinc deficiency causes what? Zinc deficiency causes acrodermatitis enteropathica, and it also causes hypogonadism or infertility. Okay, hypogonadism, very important question also. Fine. And guys, it also causes already MCQ hypojuicia, that means low taste sensation. Okay. Then guys, copper deficiency causes Menkes disease. Okay, Menkes disease. Selenium, I told you. Chromium is a part of glucose tolerance factor. Already MCQ, GTF, glucose tolerance factor. That is something which increases the insulin sensitivity. Chromium has been tried in the treatment of diabetics also, right? But not a only solution, right? But yes, you should remember GTF, glucose tolerance factor, which also has niacin. Okay, guys, so these are the important minerals and their disorder. Moving to our next question, xeroderma pigmentosum is a disorder which occurs due to defective DNA repair mechanism. And the patient presents with a dry skin, photosensitivity, and the skin cancer. So UV induced disorders, like, these are generally UV damage. Ultraviolet rays, when they are exposed, when we are exposed to them, they produces something that's called as, very important, pyrimidine, or one of the pyrimidine is T. So thymidine dimers. Don't forget this. Very, very, very important. Okay. And guys, this is repaired by nucleotide excision repair. That is our answer. And if it is defective, the disease is called as xeroderma pigmentosum. Okay. Fine. So, if there is a defective mismatch repair, the disorder is hereditary non-polyposis colon cancer. If there is a deficient nucleotide excision repair, the disorder is called as xeroderma pigmentosum. There is one more disorder that is called as, it presents with the 100% risk of cancer. Yeah, I can write skin cancer risk. Okay. So risk of skin cancer that is also present here. Then deficiency of base excision repair. Okay, base excision, like, it removes the uracil base, the wrong base. Guys, this is not causing, till now, not much disorders are known, but there is a gene that is called as MUTYH, right? Okay, so that is the name of the disease, and gene MUTYH associated polyposis means increased colon cancer risk. So guys, that's a type of actually a colon cancer, right? That's the name of a gene which codes for the enzyme which helps in removal of unwanted bases. Like, this is adenine, this is uracil. So uracil should be removed from DNA. That is base excision repair. And what does nucleotide excision do? Repairs the UV damage. And what does a mismatch repair do? Mismatches, like A bind with the G. That is mismatch. This is not mismatch, right? This is wrong base. A bind with the G, A bind with the C, like that, or the T bind with the C, T bind with the G. Okay, guys, also remember one thing, every day we are also exposed to a lot of chemicals which produces the reactive oxygen species in our body, which damages our DNA. So ROS repaired by, answer is base excision repair. So whenever there is a reactive oxygen species like superoxide, it damages the DNA and it is repaired by base excision repair. That can be important. So please remember it. And also, I just want to tell you that the damage which is caused by, let's say, the X-rays, ionizing radiation, okay, that can also be repaired by base excision repair. Okay, single strand damage basically. Okay, so guys, these are the three names I told you. Homologous recombination needs BRCA1. So what is the name of disease? You can remember the name of disease is familial or hereditary cases of breast cancers and ovarian cancers. Okay, so in the homologous recombination disorders, there is ovarian and breast cancers. Fine. Okay, so you can remember that. Then guys, I just want to add one more line: non-homologous and joining. Non-homo, one is homologous, right? Homologous means, taking the information from the other chromosome. We have the 2 copies of each chromosome. That is homologous. But if the DNA is lost and it is still repaired, that is called as non-homologous and joining. Just join the ends. So guys, the disease deficiency of this can lead to SCID, MCQ, severe combined immunodeficiency. SCID, right? Already being part of MCQs. MCQs, except the C, disease of C, all are MCQs. So my answer right now is B. Clear, guys? That's all about the. So don't forget, that can be a new question. That is, damage caused by reactive oxygen species in X-ray can be repaired by base excision repairs. Okay. Which of the given are competitive inhibitors? See guys, actually when you have seen this question, I would go for all the options are correct, right? Okay, but sulfonamides do not inhibit directly, they indirectly inhibits the, because the PAB analog, it doesn't inhibit the folic acid synthesis directly. So just in that case, I will go with the answer D. Otherwise, I would go for all of the above, right? Like disulfiram inhibits aldehyde dehydrogenase, correct. Ethanol inhibits the methanol poisoning, basically. So ethanol binds with alcohol dehydrogenase and displace or make it unavailable for methanol binding in the cases of poisoning. Allopurinol inhibits xanthine oxidase, hyperuricemia. Statins inhibits HMG reductase, hypercholesterolemia, right? So nothing much here, you all know already, right? Complex 3 of electron transport chain. So guys, this is again one of the question apart from vitamins which is very commonly asked, that is inhibitors. Okay, so you should remember all the inhibitors of ETC. Like for example, cyanide, rotenone is for complex 1, malonate is for complex 2, dimer-caprol is for complex 3, and cyanide is for complex 4. Now if I want to add for complex number 4, it's cyanide, H2S, azide, that everybody forgets, azide, don't forget this name, azide, okay, and carbon monoxide. So these all are complex 4, which is most common question in the exams. Right now our answer is B. Okay. Then dimer-caprol is also called as British anti-leucite. So that name you should know. Right guys. Complex 2 is also inhibited by carboxin apart from malonate. And complex 3 is also inhibited by antimycin apart from BAL, antimycin. Okay. So I told you complex 4, 3, 1 and 2, all of them. Right guys, inhibitors are very, very important. Also remember one more inhibitor, and that is called as atractyloside. Okay, that is inhibitor of ATP, ADP translocase. Okay, translocase, right? That is called as translocase. So ATP, ADP translocase. Clear? So that is, you should know that also. And guys, don't forget dinitrophenol, very, very, very important. That is a case of uncoupler, okay, of oxidative phosphorylation. Uncoupler of oxidative phosphorylation. So guys, don't leave any inhibitor, especially in biochem, because there are very few. In forensic, you may have a lot of other names, but in biochemistry, the list is very small. Hardly 14 or 15 names are there that you can easily gulp down, right? And questions are, there are high chances that you will get one question, right? 40-year-old male present with a joint pain and long standing black urine. So as soon as you see the black urine and joint pain, it's a arthropathy caused by deposition of homogentisic acid, right? So on examination, right, black pigmentation on the sclera and pinna, right? So ferric chloride test is non-specific and Benedict is also non-specific, so you're going to ignore that. What is your probable diagnosis? So guys, it's a case of alkaptonuria or it's a case of ochronosis, right? We can also say this is a case of ochronosis. Fine. Okay. So see, it is a 40-year-old. So it's not an inborn error of metabolism as such, like the babies are not affected. The PKU patient, you will definitely get the baby present with, hyperpigmentation or the light skin color and some other features like mental retardation. Homocystinuria, the baby presents with, or the child just 2 to 3 years old, when going to the school was unable to focus on the blackboard. So lens dislocation in homocystinuria. Though joints are also affected, but not the black urine. Na? Then MSUD, the term that is most important is the burnt sugar order in the urine, and again in newborn child. Never reach age of 40 years, right? So it's only alkaptonuria which is possible here, even if I don't know the black urine disease. Correct? Fine guys. So alkaptonuria. Guys, just a mnemonic for that. So when I write alkaptonuria, alkapton urea. Okay. So see, alkaline, the name actually was taken from the word because homogenesic acid has a very high affinity for binding alkalis. That's why the name was given alkapton, alkalosis, alkaline, I mean to say. Okay, just to remember, see, what's the name of deficient enzyme? Homogenesic acid oxidase. Okay, so how we can remember it? That, imagine a girl, her name is Alka, right? And she was going to the gym, right, to tone her body up, right? Okay, so alkapton. Yeah, she was also wearing the cap in the gym. So Alka went to the gym to tone her body, right? And in the gym, she met a boy, right? Or a gents, right? Like, I'm meant to say the male or the boy. So who was homo, right? Okay. Tendency to be homo, right? So no need to elaborate that. You got my point. So homo gents, right? Just to remember, like homo gents. Fine. So Alka, and she was in the gym. Imagine like this, to tone up her body, alkapton urea and homo gents. Simple. You can remember it now. Okay, because this is again a very, very common question in the exams. See, in this question, they have asked diagnosis, but this is a less common question. The question will be name of enzyme. Clear? So guys, don't forget, in biochemistry, the most important is to remember the name of enzyme first, then anything else second. Okay, fine. Insulin stimulates the fatty acid synthesis by all of the following mechanisms except. See guys, insulin is an anabolic hormone, so it helps in making cholesterol, fat and everything, like glycogen, protein. Okay. Increase activity of acetyl-CoA carboxylase. This is a rate limiting enzyme, so yes, it do this. Inhibits pyruvate dehydrogenase. No. First, let me take this option C. Decrease concentration of cyclic AMP. Yes, guys, cyclic AMP is a secondary messenger of glucagon. So obviously insulin, activates some enzymes like phosphodiesterase and decrease the activity of cyclic AMP or the glucagon. I meant to say both, they both act opposite, na? So cyclic AMP is glucagon messenger. Insulin should decrease it. Yes, correct. Increase the transport of glucose into the cells. Yes, by increasing the GLUT4. So GLUT4 is which is only found in the muscles, heart and adipose tissue. Guys, heart again has 4 chambers and 4 means GLUT4. Because examiners sometimes ask GLUT4 is present in, and they give the option heart and we forget easily. Because we don't remember heart. Heart is a small organ which normally use fatty acids, but also can use glucose, and it has GLUT4s, though it is using very less glucose. So remember, like 4 chambers of the heart, GLUT4. And I told you also in the Pompey's pump heart, alpha 1-4. Heart has 4 chambers. Clear, guys? Okay, so all of them are correct except the option B. So guys, even you are unable to answer it, you can check the other 3 options. So this is a rate limiting step of fatty acid synthesis. This is antagonizing in glucagon action, and transport of glucose is correct. Why it is not inhibiting PDH? Obviously guys, PDH is an enzyme which converts pyruvate to acetyl coenzyme A. So that is done by PDH complex. And this acetyl-CoA is acted upon by acetyl-CoA carboxylase to make the fatty acid. So obviously we should not inhibit PDH, right? It should be active. Clear? Fine. Which of the following is not true about restriction endonuclease? Okay, let's see options. Option A, correct. So, okay, what was the answer for the last question, guys? Option number B. Which of the following is not true about restriction endonuclease enzyme? Right? So, it cuts the palindromic site, correct. Breaks the DNA and creates sticky ends, yes. Palindromic sites like GAATTC. Okay, that is on the one end, GAATTC. So it reads same 3 to 5 up and 3 to 5 down. Reading same, na? in one direction, 3 to 5. So that is palindrome. So it cuts here and creates the sticky ends which will have the free bases. Breaks the sugar phosphate bond, yes, but not the hydrogen bond. So this is my answer, right? That's your answer. Guys, which enzyme breaks the hydrogen bonds? Helicase. Okay, helicase. So helicase breaks the hydrogen bond, not the restriction endonuclease. Okay, guys, helicase deficiency present with Bloom syndrome. Okay, one of the question, and also present with Werner syndrome, which is also called as adult progeria syndrome. You have seen the movie Pa. In the Pa, it was Hutchinson-Gilford progeria. But, this is Werner syndrome. So where the faster aging starts after a certain age, not in the childhood, but after a crossing certain age. Let's say after crossing certain age of 20 years, 25 years, like that. Okay. So that is called as a Werner syndrome. And the Bloom syndrome. So both the disorders are linked with cancer, right? High incidence of cancers. Okay, 7-month baby present, 7-month-old baby present with the complaints of vomiting and irritability. On examination, found to have hepatomegaly with jaundice. Okay, and it started after weaning. So 6 months is given the breast milk, right? Exclusive breast milk. But this is a weaning phase, that is the baby is consuming top feed. So present with these features after consuming fruits and vegetables. Urine has Benedict test positive, right? So this, don't think about diabetes here because it's hepatomegaly and jaundice is also present, and vomiting, and this is 7-month-old baby. So Benedict test may be positive by fructose also. So guys, what is our important point here? Age and fruits ka history. 7-month baby, which is not given breastfeeding now, I mean to say not exclusive breastfed baby now, and fruits, fruit history of fruits. Fruits means fructose. Okay, so guys, just to remember, this is a case of hereditary fructose intolerance, not the essential fructosuria, because that doesn't present with any symptom. This is hereditary fructose intolerance. Just to remember the mnemonic, that all bees, imagine the honeybee, all the bees, okay, love high fructose items. Correct? So what I mean to say is, all bees means the name of enzyme is aldolase B. Okay, and it is deficiency causes the disease that's called as hereditary fructose intolerance. Okay, remember this much. So what is important? History of no clinical features still given exclusive milk-based diets. I mean to say breastfeeding, because milk has no fructose. But symptom starts only after given juices, honey, or something like that. Okay, so guys, my answer here is the only option says aldolase. Okay, or fructose 1,6 bisphosphate aldolase. Remember, aldolase is also found in the glycolysis, right? Okay, it is also found in glycolysis. So guys, this is actually, I want to say something here. This is the answer which is given not correctly. Please, let's change it. The answer should be fructose 1-phosphate aldolase, not 1,6. Okay, 1,6 bisphosphate aldolase is found in glycolysis. So don't worry, in the exam, most commonly you will see aldolase B as the option, or fructose 1-phosphate aldolase is the option, not this one. Okay, fine guys. Okay, so not the A. A is the case of essential fructosuria with no symptoms. Guys, transparency of cornea. Remember, cornea needs keratin sulfate. Okay, so this is my answer, B. Right? Heparin sulfate is found in the renal or the glomerular basement membrane. So important for filtration, it provides the negative charges basically. That is also the question, heparin sulfate. Okay, fine. Moving to the last question of our discussion. So a patient with an intellectual disability was found to have hyperuricemia, self-mutilation. So see, intellectual disability is also there, that is mental retardation, right? Self-mutilation. Which of the following enzyme is deficient? So guys, this is the line here. Unique point, self-mutilation. No other disease you will find the self-mutilation, right? This is the only case you will find it. So the answer is Lesch-Nyhan syndrome, and answer is C. Okay, C is the correct answer. See, the finger is shown, that means mutilation. Okay, just to remember, LESCH. So guys, L for the lips bite. Okay, E, just to remember, excess uric acid or urate. S is for self mutilation. C for chorioathetosis, and H for the name of enzyme, that's called as HGPRT. Okay, HGPRT. Fine. I can also remember H for hyperuricemia. But again, the uric acid you have to remember. What hyperuricemia. Fine. And guys, I can also remember that Lesch-Nyhan syndrome is a case of, defect. Very important. Defect in purine salvage pathway. Right? Purine salvage pathway. Salvage. Don't forget this. Sometimes they can ask you to just directly the name of this pathway, not the name of enzyme. Fine. So purine salvage pathway, that is also the correct point, right? Okay, right guys. And L, I can also remember L for low IQ. That is mental retardation, right? Low IQ. And guys, Lesch-Nyhan syndrome is a X-linked recessive disease, and so boys are affected most commonly, right? Okay, so the patient who is affected is, him, not her. But just to remember, remember it like this way: X-linked recessive Lesch-Nyhan syndrome. That's the case. Enzyme deficiency is almost 100% in Lesch-Nyhan syndrome. Clear, guys? So this is your faculty, Dr. Amit Jain, right? And I wish you all the best for the upcoming exam. Hope you enjoyed the session. Let me know, right? If anything you want to add here. Thank you so much, guys. All the best. Bye-bye.